Hello, everyone. Today, we would like to provide you with a walkthrough of the capacity planning tool that we had created for another regulator in the region who was undergoing a major transformation in their mental health strategy. Two of the key challenges that they were facing were amongst patients weren't coming forward for treatment, and then secondly, there wasn't a sufficient workforce to be able to treat them. This model aims to predict one, if you're looking to close that care gap, how many people would you expect to be seeking care? And two, what are the workforce requirements to ensure that patients are receiving optimal care by the right healthcare professionals for them? This particular model was used to plan for the next 5 years, but designed to be flexible and operate over a longer time horizon as required. As we built out this model, we utilized a bottom-up approach, assessing the behaviors of the different mental health conditions for this particular client to estimate the workforce required and inpatient facility requirements for each distinct condition across the different severity levels of mild, moderate, and severe. This dashboard serves as an interface for an Excel-based tool that holds all the parameters, assumptions, and underlying data. The Power BI dashboard and model have both been very well received by the client and have been utilized as the basis for their workforce planning for the coming 5 years. We leverage a bespoke approach here for our client projects and can definitely adapt this to the needs of the Ministry of Public Health in Qatar, and we'd be happy to do a live demonstration should that be something you are interested in. So I will go ahead and get started on the model itself. So as you can see here, we've landed on the overview page, which provides you a snapshot of the total patients expected and workforce summary. There are different parameters that you will find across this model that you can toggle with to play out different scenarios. So to start off, for your present versus future scenario, you can start off with today. So what is our baseline patients and what does that translate to in terms of total workforce requirements? And then as we start looking out to the future, we can select that as well. For the percentage of population seeking treatment, we modeled it under two different scenarios. So one was organic growth in the sense that if nothing changes, what is the expected patient demand and what is the respective workforce requirements? For the second option there, projected future model of care, as this particular client shifted towards a more primary care-led model, how does that impact the number of mild, moderate, and severe conditions? Thirdly, the percentage of population growth rate per year, which can be increased in 1% increments, the percentage of benchmark prevalence. So how many people do we believe to be living with mental health conditions in any given area? And then lastly, here we have the year. So this particular model goes up to 2050, but as mentioned, this is flexible and it can be built out to operate over a long time horizon if needed. So before I get to the details, I also just wanted to go to the model inputs page here, because in addition to those few parameters, the model heavily relies on these particular inputs to drive all the given outcomes. So as you can see here, we have each individual mental health condition that we were assessing. And here you have percentage of population seeking treatment. So for those suspected to be living with dementia, what percentage of that population is actually coming in to seek care? And then of that population, what do we believe the distribution to be amongst the different severity levels of severe, moderate, and mild? So for example, if I change this to 40%, we can immediately see that the number of outpatients and even the percentage of population seeking treatment has increased. And then if we want to change the distribution of the severity levels, severe to 10 and moderate to 10, you can see that the mild percentage auto-calculates to reflect the total of severe and moderate. Another element to call out here is that this model is quite dynamic in the sense that if new conditions were to be added, so other mental health conditions that the client would want to consider, they would be able to add it into the underlying Excel that holds all the data and factor it into the model. So coming back to the overview page. So as mentioned, after you've selected the different parameters for the scenario that you want to model, here you can see there are a number of summaries. So one, the number of predicted population. So ultimately what this is telling you, of the total population in a given area, how many people do we suspect to be living with these mental health conditions in total? And from there, how many people are actually seeking treatment? And of that, what is the subset of patients that would require some form of inpatient care, especially if they're on the more severe side of the condition? The model also calculates for those severe patients requiring inpatient treatment, what is the number of beds required? And then similarly on the model inputs page, we also here again have the percentage of population seeking treatment. So coming down to some of the details, on the left-hand side, we have the patient summary, which is essentially a breakdown of, for each given condition, what is the number of outpatients and inpatients expected? So for anxiety, we expect about 56,000 in an outpatient setting, and inpatient about 600. On the right-hand side, what you will see is for all the different conditions and to be able to treat all outpatients and inpatients across the different severity levels, what is the workforce requirement we would need to be able to deliver them optimal care? So here you can see the different categorical levels we have for each healthcare professional. And then if you scroll down to this table, you can also see some of the specializations that we factored into this model. So for your allied healthcare professionals, we have occupational and speech therapists. And if we scroll down a little bit further, for psychiatrists, we have, addiction, child, your general as well, and then your geriatrics. So this page is meant to serve as a snapshot of total patients expected and total workforce required to be able to meet patient demand. The next two pages are a bit more of a detailed view. So starting off here, we have what is the total workforce requirement and also the inpatient beds requirement on the left-hand side. And this can be toggled between total healthcare professionals, which means your outpatient healthcare professional requirements, and your inpatient can be looked at for outpatients only, inpatients only as well. And then lastly, you can also get a view of the different inpatient beds required to meet the demand. So if we toggle to outpatient healthcare professionals, we can see here, for example, if we look at anxiety disorders, that primary care practitioners will be our largest gap for 2030. And social workers and allied healthcare professionals won't require much attention. Similarly for inpatient healthcare professionals. And then the other thing to call out is on the right-hand side, you also will have the breakdown by subspecialty, similar to the table on the prior page. So for your inpatients, we have our psychiatrists, and then we also have the breakdown of psychiatrists required across general, addiction, child, and geriatric. And then lastly here, we have a view of the inpatient beds. So for all of the different mental health conditions and the number of patients we expect to be on the more severe side of those given conditions, what are the different bed categories that we required for this particular client? We modeled out adult, child, and SUD, so substance use disorders. And then lastly, moving on to the last page, here we have an overview of the summary by any given condition. So here you can select 1, 2, 3 conditions, or all of them. Right now it's selected on all. This gives you a more detailed summary of the patients. So you can see the outpatients by age across child, adult, senior, by the different severity levels, mild, moderate, and severe, and then similarly for inpatients. And then on the right-hand side, again, another summary across outpatient in gray and then inpatient in gold. And then here, as mentioned, you can select one or multiple different conditions. So if we select bipolar, the page will update to give you a breakdown of the patients by age, severity across outpatient and inpatient, specifically for bipolar conditions, and respectively also updates the summary here. So that concludes the walkthrough of our capacity planning model. As mentioned, should you like to have a live demonstration, please feel free to reach out to us. And if there are any questions that you may have, please feel free to reach out to the team and we'd be more than happy to answer them. Thank you so much.